So whenever you are listening to the heart and lungs of your patient, you want to listen to the left side and the right side of the valves of the heart and all of the lung fields. So this patient, I'm going to go ahead and listen to the heart first. So on the left side, I'm going to listen to the pulmonic valve, the aortic valve, and the mitral valve. And you want them standing, preferably. It's okay. And you want to listen for a minute for beat irregularities, arrhythmias, and things like that. On dogs, sinus arrhythmia is normal. For cats, sinus arrhythmia is abnormal, so you definitely want to bring that to the attention of your vet. On the right side, you want to listen to the tricuspid valve. So he has a normal rhythm. It is slightly fast because he's excited, but his rhythm is nice and steady, it's even, so he doesn't have any kind of arrhythmias. I'm going to go ahead and get his heart rate, which I will count the beats for 15 seconds and then multiply that by 4. So his heart rate is at 156 beats per minute, which is normal for an excited puppy. Then you want to listen to the lungs as well. On a small patient, you want to listen 1, 2, 3, 4, and 5, which will cover all of the lung lobes. So we'll go ahead and listen to that. We are specifically listening for any crackles or wheezes or lack of sound that would alert us to any kind of respiratory issues or collapsed lungs or anything like that. So let's go ahead and listen to the lung fields here. So this patient's lungs sound fabulous. They have no wheezes or crackles. He's not having any stridor or any kind of high-pitched wheezing or anything like that. They're effortless breathing, equal bilaterally. His lungs sound great. He doesn't have any murmurs in the heart, no arrhythmias or anything like that. So he checks out. His heart and lungs sound great. So when using a rabies pole, some instances that you would want to actually use the pole would be in a rabies suspect patient or an overly aggressive animal that you cannot put your hands on, so it keeps them restrained and at arm's length. I'm going to demonstrate how to do a rabies pole on a dog. You want to make sure the loop is open and that you approach from behind. We're going to try to slip this over his head. There. And you want to engage this right behind the head, lock it, so you have control of him at all times. And then you can release. To properly clean a kennel, you want to first remove all bedding and blankets and food bowls and water bowls. Clean out as much of like excess waste as you can. Any piles of feces, you obviously want to get those out before you spray. The initial cleaning you want to do with soap and water to get any kind of dirt away, because disinfectants are usually neutralized by dirt and organic material. So we're going to do a cleaning with some just soap and water here on the sponge. We're going to start with the top. So any debris that falls to the bottom will be cleaned out last. Then we're going to go to the sides and the back. And then last, after you've done the top, the sides, then you want to go to the bottom and get any of the drops that have fallen from the top or the sides. And then you want to clean all surfaces of the door as well. And then after you have scrubbed it with soapy water, then you want to wipe it out. And then once that is wiped and dry, you can use your disinfectant that your clinic uses. We use ProVet Logic here, and on the back it will tell you your contact time for different bacteria and viruses. This one all the way around takes 10-minute contact time for viruses and bacteria. So you want to spray this 6 to 8 inches away from the surface. Thoroughly coat all the surfaces. And then whenever you're spraying the cage door, you want to make sure you're not spraying into another patient's cage. After you have thoroughly sprayed the cage, you let that sit for 10 minutes and it will dry on its own. So after your 10-minute contact time, you do want to wipe the surfaces with soap and water again to get that disinfectant off of the surfaces. You don't want to keep that on a surface that a patient can eat off of or drink off of, just in case they do lick that dried disinfectant off. So we have our soapy we're gonna again start with the top of the cage, so in case anything drips down, we'll be able to wipe that away at the end. And then we're gonna do the sides. And the bottom. And the door. And once that is complete, your cage is ready to be used for your next patient. Whenever cleaning a cage, you want to do the wiping down in the correct order. We always start with the top and then proceed to the sides and the back before wiping out the bottom. There's a couple reasons for this. One is because the patient is in direct contact with the bottom, so we don't want to spread those germs as we wipe, so we save that for last. And then also whenever you spray and wipe from the sides and the top, things can fall down to the bottom of the cage, so we want to make sure that at the end of the process that those get wiped. Alright, now I'm going to demonstrate how to express anal glands on a dog. You want to have some baby wipes or paper towels, lube, and some kind of spray for afterwards. You want to get some lube on your finger. And then you want to insert to the first knuckle, and then your anal glands are going to be on either side of the anus at about 7 and 5 o'clock. Once you've found them, you want to gently milk the gland till it empties. Those are both emptied now. And you want to clean him up. Give him a good spray. And then you want to document that in the record. If there was any issues actually expressing the glands, or if there was any kind of blood, or if they were super thick or hard to express, you want to let your doctor know and put that in the record. So we are going to apply a topical medication to Riley's back. He has some crusts here. This is a duoxetine mousse. We're going to take this, and with gloves, we're going to put this back and then massage that in. Once that has good contact time with the area that you're applying it to, you want to let that dry, and that's it. As with any kind of medication administration, with topical medications as well, you do want to make sure you document everything in the patient's record, so it is known that that has been done and it doesn't get redone or skipped over. You just want to document that. So we are going to clean and medicate this patient's ears. She has a yeast infection. So we are going to go ahead and use some flush on our cotton tip applicators and also on some cotton balls. And then you kind of want to lift her pinna. Squeeze the cotton ball in there. Massage so you can get some of that debris broken up. And once you do that a couple times, you can see if she wants to shake her head. Yeah, no, not really. Okay, so we'll take our cotton tipped applicators and just kind of clean the crevices out of the top of the pinna. Okay, so that looks pretty clean. Now we'll wait 20 minutes after we clean the ears to actually put the medication in them. So I'll go ahead and do her other ear. Alright, we'll kind of wipe them out so they can sit for 20 minutes and then we'll medicate them. Okay, so after 20 minutes, after we've cleaned her ears, we're going to go ahead and apply this medication that stays in the ears for 30 days. You want to hold the pinna up, put this down into the canal. Once the bottle's empty, I want to massage. Okay, and we'll do the other one the same way. Alright, so we are going to clean and medicate this cat's ears. We have some saline here that we're going to use to clean the ears out, and then if we were to medicate, we would use the Tresiderm. We're going to go ahead and put some saline on these cotton balls and cotton tip applicators. Alright, and then my assistant's just going to hold him. So we'll just put the cotton ball down into the canal and I'll wipe it out. Oh, I know. It's gross. It's cold, honey. And then once you don't get any more debris, you can kind of get the crevices with the cotton tip applicators. I know. Gross. Alright, we'll shake. And then we'll get the crevices. Alright, we'll wait. And then we'll wait 20 minutes after the cleaning before we apply any kind of medications. So after the 20 minutes, once the ears are dry, you want to take your medication. Make sure you know the directions. We would have him restrained. You want to have the pinna erect. You would get your medication and not touching it to the ear, but you want to drop the medication so you can actually see the amount going into the ear. You want to have it above the actual pinna. Then you would massage the ear canal, and then you could shake at that point, and then you would move on to the other ear. That's how you clean and medicate a cat's ears. Whenever cleaning and medicating a patient's ears, you always want to make sure you document everything in the patient's record whenever you're done. Okay, so I'm going to demonstrate how to do a nail trim on a dog with the patient properly restrained. You want to pick up the foot, identify the quick, and on clear nails you can see the pink, and that is where the quick is. So you can cut small portions down to that area. And then you want to make sure if they have dew claws, you get those. His are removed. Same thing for rear nails. And his are filed down pretty short. So if you were to cut the nail too short and go into the quick, you have styptic powder here, or quick stop. And you can pour that. Put a small amount on a gauze or a paper towel. You don't ever want to put the nail into the powder because that contaminates the whole bottle. And then you would take the nail and apply it into the powder until it stopped bleeding. Then you can wipe the excess off. And that's how you do a nail trim on a dog. Alright, we're going to do a nail trim on a feline patient here. So you want to have an assistant that is available to hold. I'm going to come to this side. For cats, you want to first get their nails out of the towel. You want to push on the paw pad to extend the nails. And with clear nails, you can actually see the quick there. And you want to cut at a 45-degree angle. So to administer a pill to a dog, you want to hold his lips up, take your pill between your pointer finger and your thumb. With your middle finger, lower his bottom jaw, put it in the back of his throat, he swallows, and then we'll give him some water just to make sure it goes down, doesn't get stuck in the back of his throat. Encourage his swallowing. Good. That's it. So we are going to administer a pill to this cat. You want to have a syringe with water. After you put the pill in his mouth, you want to give him some water to encourage swallowing and make sure it doesn't get stuck in his throat. So with your assistant holding him sternally, you want to grab on each side of his jaw, get your pill between your fingers and use your middle finger to move his mandible down. The pill in the back of the throat. And then after that, you're gonna put some water in his mouth to encourage swallowing. And that's it. As with any kind of medication administration, with topical medications as well, you do want to make sure you document everything in the patient's record, so it is known that that has been done and it doesn't get redone or skipped over. You just want to document that.